I want to read to you something that a nurse at Rush Copley wrote and posted that went viral over this past weekend. And I want you to look in her eyes and look at her face, and pain and frustration, tiredness that you see, weariness that you see. And I want to read her words to you, to everybody listening. So I don't have to say it anymore. We'll listen to Carol Williams. Just stop, she says. Stop thinking this is just like the flu. It isn't. Stop telling me the survival rate so it's not a big deal. It is a big deal. Stop saying healthcare workers signed up for this. We didn't. Stop ignoring science-based recommendations of masking, social distancing, hand hygiene, and not gathering in large crowds. They work. Stop kidding yourself that this isn't going to affect you or someone you love or know. It will. Stop thinking that only unhealthy people with pre-existing medical conditions or elderly people are the ones dying. They aren't the only ones. Stop being confident that if you get sick from anything, the resources to save you will be readily available. That may not be in this stage of the pandemic. Stop believing hospitals aren't being overrun because of massive influx of COVID patients at this moment. They are. Stop thinking if they make makeshift areas to house more patients, there will be properly trained staff to care for them. There may not be. Stop believing that all frontline healthcare workers are properly protected with PPE. Many across this country still are not. Stop ignoring that healthcare workers are also getting sick themselves. It's happening. Stop politicizing this virus. It's a public health crisis. If you are taking this pandemic seriously, doing the best you can to be safe and protect others, thank you. If you are not, please start now. I am begging you. Anyone that has asked me how things are going, I have given them my unfiltered COVID ICU nurse experience. No one wants to believe this is happening in their own backyard, but it is, and it isn't pretty. This picture is of me spending 5 hours inside a COVID positive ICU room, working to save a patient. In this moment, I felt defeated because I already knew what the outcome would be, even though it hadn't happened yet. The inability to save a patient despite doing everything you can is mentally exhausting. Now imagine doing that on repeat for 8 months and counting. Imagine watching a patient suffocating through a door while scrambling to get your PPE on because they inadvertently removed their mask. They desperately need to breathe, but you still need to protect yourself first. Imagine being the nurse crying with your patient when they realize that everything we're doing to help them still may not be enough and death is a real possibility. Imagine being the nurse and doctor telling a patient we need to put them on the ventilator because we have exhausted all other measures. Calling or FaceTiming their family so they can say, I love yous and encouraging words, while in our heads where we know for some patients, this is the last phone call they will have with each other. Imagine being the nurse or doctor holding that same patient's hand and stroking their heads weeks later while their ventilator is removed because they haven't improved, and their family then says goodbye and I love yous over FaceTime while they take their last breath. Now, please imagine being the COVID ICU patient. The breathlessness, pain, fear, loneliness, isolation, anxiety, hopelessness, and sadness. The need to use all of your energy just to breathe. The true realization you may not get better and facing your own mortality. We do our best to calm fears, comfort, and connect while providing the best care we can in their most vulnerable moments. I promise anyone reading this that your healthcare team will fight for you with every ounce of their being to get you better until every measure has been exhausted, whether you are hospitalized with COVID or any other illness. Please do not discount all the lives lost or affected by this pandemic any longer. We need to come together as a country now. We need to come together. We need to work together now. Remember her words. Remember the anguish on her face and in her eyes. Remember the look of exhaustion. And recognize what we have to do for our family, for our friends, for our neighbors, and our community. With that, unless anyone has anything else you want to add, I'll take a motion to adjourn this meeting.
So moved.
Second.
There's been a motion by Alderman Howard Burns, second by Alderman Garza. Clerk, can you please call the roll?
Alderman Yamas?
Yes.
Alderman Garza?
Yes.
Alderman Masiacos?
Yes.
Alderman Didnt?
Yes.
Alderman Franco?
Yes.
Alderman Seville?
Yes.
Alderman Howard Burns?
Yes.
Alderman Smith?
Yes.
Alderman Bug?
Yes.
Alderman Lofshe?
Yes.
Alderman Jenkins?
Yes.
Alderman O'Connor?
Yes.
12-8.
This meeting is hereby adjourned. I'll see you all next week.